Well, the overall aim of TCAB is actually to improve the patient's experience of care, to make people feel better about their hospital stay. I think often we focus on care interventions or procedures or processes, but it's about how people feel about their experience that can make a huge difference on an individual basis. So that's what we're trying to improve. We're trying to make people feel positive about their stay.
The most innovative thing about it is the fact that the ideas come from us as frontline nurses. We're coming up with ideas to try and make a difference. One of the things that I've never been involved with before is we've been in contact with what I call lean consultants who are looking at how we work on the ward and how smart we work on the ward. It's not necessarily giving us more time, but what it does is the time that we have with our patients is more directed to cutting out the waste that we sometimes have. One of the ideas is what we call a snorkel, or what originally was known as a deep dive, where we get a lot of nurses around a table and throw ideas at each other to try and come up with some innovations of how we might transfer the care that we give. And some of these innovations can be quite off the wall. But what it does is gets us thinking about how we nurse and how we might change our nursing techniques and to come up with new ideas to help patients and get us spending more time with patients.
Some of the interventions we focused on in the last 9 months have been the lean activity follow, staff have been followed, falls and pressure ulcer incidents charting, opinion and suggestion boards for staff, and filtering of phone calls.
At the moment we're located on a different ward at the moment where we're being refurbished, and we're working in team nursing, whereas we hadn't done that on our old ward. So we're hoping that when we go back to our new ward, it might be a way that we can work. We're finding we're having more patient contact, the patients are finding that we're more visible, and it's looking like a better way to work.
Well, one of the things that has come out, it was on a specific intervention really. We'd come up with an idea that we thought that the patient would really help us as nurses and medics, and it was a sort of a live fluid balance chart that was populated. It was actually by the patient's side, written up on the wall rather than at the bottom of the bed, lost in lots of papers. And we as nurses and doctors thought this was fabulous. But when we went back and we asked the patients, it made them concentrate so much on their fluid balance that it actually upset them. So one of the biggest things is that we have to make sure that when we're doing TCAB that the focus is always with the patient. The focus is always what's best for them, as well as what might be easier for us. The next steps within TCAB on Ward 5 are putting into place more PDSA cycles within the ward. The ideas that are generated from the deep dives and from discussing how we might change care with our patients comes up with little ideas. We want to try and change our discharge planning. It seems to be a little bit not as structured as we might like it at the moment. So we've got some various ideas to go through with that to try and get discharge more structured.
Our next steps are to continue the enthusiasm and momentum that's already ongoing on the ward, and to consider different methods of working within our team.
It's been really positive actually. Staff feel like they're getting listened to, and ideas that we put forward have been acted upon, and suggestions have been carried forward. It's been really positive.
The little ideas they've had that could make a difference have been taken on board, and they've been allowed to use them. Small ideas or small suggestions can make a big difference to the care we deliver to patients.
But I think the more people have gone into it, the more people that have looked at how it might help us, and the deeper they go into TCAB itself, the more they realise that it's giving them power to actually make some changes that they constantly talk about, but we sometimes never get time to do.
The general feedback from patients is that they feel that they can voice their opinions and that the changes have been quite positive to their care. They feel part of the planning of their care.
One patient responded when she was asked what we could do for her in that day, and she said that despite being very poorly, she could see that staff were very busy and just felt like she belonged because she'd been asked that question, and all she really wanted was to be repositioned in bed.
I think the 1,000 Lives campaign is so important because these are specific measurable tasks that we can do, specific measurable things we can do, and it's frontline nurses that are making the changes. They're able to look at what we're doing, measure what we're doing, and then make improvements, measure again, and see if we can make a difference for patients.
I believe the 1,000 Lives campaign has been important because it is reducing harm to patients and reducing risk, and we're re-looking at the ways that we're working to improve the care.
It focuses on the patient experience and how the patient feels that their care is delivered to them.
It's bringing clinicians together to lead change that's going to make a difference for patients, that's going to save lives, that's going to reduce mortality, and that's going to re-energise healthcare professionals around the work that we do.